Hey, welcome to Coachella Valley Primary Care. And we're talking today about how things are changing when it comes to medicine. And the two people I have on today are actually going to change that. They actually said, "Hey, we're not waiting. We're going to make a difference. We're going to actually take when we talk about a pivot. Here's a common term right now. It's bantered about so many times. Hey, we're going to take a pivot. They took a hard right turn from what they were normally doing and said, we're going to change the face of healthcare, and they're going to do it one patient at a time. And I'm really excited to bring them on. Let's bring them on now. And I want to welcome Dr. Burris and Dr. Kim. Welcome, you guys.
Hi, Jeff. Good to be here.
Thank you.
This is a little different format. I know you guys, you do a weekly program called, COVID-19 update that you've been doing since what? Since the beginning of the pandemic, if you will?
That's right.
Yeah, that's such a great service. Before we get into that, before we get into today's show, tell us a little bit about that and how people can catch up with that.
Well, every Wednesday at 3:00, we do a update on coronavirus here in the Coachella Valley. We do hit on bigger issues as well that are more of national world interest, things like treatments and vaccine updates. But our focus really is on the impact to the Coachella Valley, where we are in our county and our state, and how we can best protect ourselves as well as position ourselves to protect our family and our businesses, our children, the whole thing as well as we can, as up to date as we can, and we do it every Wednesday at 3:00 on Facebook.
Well, some people out there might say, "Hey, you're a primary care physician. Where do you get the expertise to talk about this?" And I want you to take a second and tell us a little about your expertise and why you have the chutzpah, if you will, to talk about this, and really so that we lean in and say, wow, I want to make sure to tune in because it's the straight scoop. It's not CNN. It's not Fox. It's nothing between. It's like this is the data points.
So I am an internal medicine and pediatric board certified physician. So that means I've been treating adults and children for a long time, over 20 years. But before I went to medical school, I actually went to public health school. And I went to Johns Hopkins and was trained in international public health. And I have a particular interest in community health. We've been involved in our community's health all along since we've been here in the Coachella Valley. And it is almost like something that's near and dear to my heart. I find that keeping up with public health issues helps me be a better doctor for my individual patients. The focus on public health is on a population level. The focus as a physician is on your individual patient. So they have slightly different focuses, but they are complementary. But being able to help people interpret what they're seeing on the news, what they might be seeing on social media, how to filter through all the conflicting information that you get in a way that's rational and not really histrionic, I think can help us face our current pandemic situation without panic, but also with some wisdom. So that's our hope, to help people.
Well, the one thing I do enjoy about this program is the fact that you guys talk about what's happening here in the Coachella Valley and cover all of that. So if you're somebody who says, hey, I need to lean in and find out what's going on, and every time you turn on the news, they're talking about New York or Dallas or Chicago, whatever, you can tune in once a week and really get the stats. And I just love that you bring that up. And it's up to date, and you talk about it, and you don't just give us a graph, but you guys talk in depth about it. Dr. Kim, tell us a little bit about your background and how you came to be where we are now before you get into Coachella Valley Direct Primary Care.
Sure, Jeff. Well, just marrying Dr. Burris, that's all the evidence you need. But other than that, like Dr. Burris said, we did our training at San Diego, UC San Diego, and I did my training in family medicine and psychiatry. So both families, but also have the mental health component. And we actually came to the Valley. We first started working at Martha's Village and Kitchen, and we did that for 8 years. We ran the medical clinic there, and so we have a good perspective on the, the vulnerable populations of our valley, and we've also worked for various other larger organizations throughout the valley here as physicians, and so we have been here for over 15 years. So we, in the valley, just know, how the valley ticks, and we care about the valley. We also, both of us, I know Dr. Burris didn't mention, but we both have also participated in research. Both Dr. Burris, while she was a student getting her master's in public health, as well as other various points, and same with myself. So we know what it takes to look at research. We know what it takes to kind of delve into studies, and then we are just very honest on how we apply that both personally to our patients and as a public health.
Well, when it comes to taking care of patients, you've had Coachella Valley Direct Primary Care for a while, and we first met just maybe 2 months prior to this whole thing breaking out and the pandemic hitting the entire world, obviously. And I want to kind of dive into why you guys did not take that traditional route. And when I think traditional route, and maybe some of the people out there is like, okay, you go to school, you get your degree, you open up an office, and you go to a hospital and you're a surgeon or you're on staff there. But you guys took a little bit different route. Like you said, you went to Martha's Village for 8 years. You've done the research, but now you have something totally different. If you could share with us, hey, what drove you to that decision?
So when we were doing what I would call sort of the regular style of primary care, we were taking care of patients within an insurance model. And over the past 20 to 25 years, the frustrations of trying to work in that model grew. And they have to do with the fact that a lot of what happens in healthcare in the United States is not really about what's best for the patient or even what makes sense from a medical perspective, but it's what the insurance company would allow you to do or the hoops that you had to jump through. So in a sense, in that system, the doctor is working for the insurance company and getting paid by the insurance company and trying to meet the insurance company's standards rather than working directly for the patient and trying to make sure that the patient's outcomes are good and that the patient's needs are being met. And that disconnect is what drives a lot of the dissatisfaction, both on the patient side and on the doctor side. I did not go into medicine to spend 3 to 4 hours a day filling out paperwork multiple times for the same drug to be approved for a patient that we all understand the patient needs. And over the years, I've had the opportunity to kind of work on different kinds of health plans and see what happens through HMOs. And it's very disillusioning for an idealistic young doctor. But as an older doctor, I'm like, this is ridiculous. Like, people are not able to get into their doctor often in a timely manner that will prevent a condition from getting worse. And that kind of thing, when people are paying such outrageous amounts of money for their insurance, is not only maddening, but in the end of the day is actually resulting in patients getting sicker and occasionally even patients dying unnecessarily. And at some point, both Mike and I were just kind of, really looking for another option for us.
Well, when it comes to healthcare, and I'm going to ask a hard question right up front. In your opinion, with the experience that you've had, the experiences you've had, is our healthcare system kind of broken?
So I would say yes and no. It is a very good system. The problem is it's kind of evolved into something that I think is now at a point where it is getting to be burdensome and hard for everyone around. And by that I mean insurance, health insurance, and the healthcare industry is kind of its own little island where it functions separate from normal economic and pressures and real life. So um, we all revolve around the insurance companies and large organizations. And when that happens, we all have to pivot when they want to pivot. So I think insurance is very good for what it should be used for, which is catastrophic events, things that'll break your bank or make life really difficult for you, but it shouldn't be for things that make life uncomfortable or hard. And by that I mean, let's say you take your automobile insurance. If I took my State Farm, if I have that and took it to Goodyear, I can't order tires and wipers and this and that. I have to pay what the market bears, and there are a lot of different places out there. So you get a fair value, and you use your insurance when the car gets totaled or for things that are catastrophic. So at least I think that that kind of a model is also a good model for insurance. Now there are a lot of medical insurance. There are a lot of different levels and complexities, but at a high level, I think if we don't start moving to that, then the price and the time and everything is going to start getting out of control where you're not going to be able to see your doctor even in 3 months, and the reimbursements to doctors are going to get lower and lower, which forces more doctors to see more and more patients, and I think the system is just going to get out of control.
Well, when you speak about that, and the doctor seeing more and more patients, what's the average doctor's load of patients that they typically have on the books?
I would say the average primary care doctor has between 2 and 3,000 patients in a full practice. And I've seen up to 5,000 patients for some people. And normally in the old days, when we maybe only had, 1,500 to 2,000 patients in a panel, you would see 15 to 20 patients a day, maybe field another 20 or 30 phone calls from patients. But now you could easily double those numbers. And when that happens, what happens is a lot of those phone calls are not actually answered by the physician. You get messages sent. Sometimes it takes a day or two for the physician to respond to the message. And it just creates extra delay in the communication process. And this is where things can get bad or go wrong or get missed. This is a concern. That inability to communicate easily and quickly is a real problem for our system. And so we wanted to try to address some of those issues.
Well, as a kid, I remember growing up, and it was a lot like what you said, Dr. Kim. Is like, not that I was a car, my parents treated me like a car or anything like that, but it's one of those things that if it wasn't an emergency, I wasn't really bad sick, I couldn't just stay in bed a couple of days, we didn't go to the doctor, we didn't go to the hospital. And we only had insurance. It was kind of that 80-20, and we called it catastrophic. So if something major happened, they had that coverage, and it was good. I never remember my parents talking about it being so expensive, but we didn't make a habit of going to the doctor. I mean, I think growing up, I barely went to the doctor. And then there was a shift, and all of a sudden there's these urgent cares, and people are going to the emergency room. I want to talk a little bit about and because you guys are great with data, is here in the Coachella Valley and across the country, there is a shortage of primary care physicians. And before you tell us what our shortage is, kind of help the people watching, maybe they're just tuning in, what exactly is a primary care? Because we may not use that term. We're just going, hey, I'm going to go see my doctor. What is a primary care physician? What are we as far as a national level, as far as being short of that? And then here in the Coachella Valley, knowing that the average doctor is going to see somewhere between 2, 3, and as many as 5,000 patients.
So a primary care doctor is a doctor that takes care of your wellness issues, so things like screening you for relevant diseases or cancers, as well as manage most basic health problems. So your primary care doctor would be the person you'd go to first if you were having a new symptom or a concern about a problem, and they'd be the person that would know you best over time. That primary care doctor also is the one who usually makes the decision to refer you on to a specialist. Usually they're trained either in family practice or in internal medicine, or if you're a child, in pediatrics. And most specialists start out being trained as a primary and then go on for additional training after that. Except for like a surgeon, they do not go through the initial family practice or internal medicine. The surgeons go through a surgery track. But most of the specialists, like pulmonologists or gastroenterologists, they're merely subspecialties of internal medicine. So your internist is that broad person who kind of has an idea about a lot of different things and would be the one to help direct your care.
So I feel like that in the day, I remember it may be before your time and probably some people, so I'm going to really date myself, but it feels like a primary care physician is like the Dr. Welby MD. I mean, it's like he knows our family, he's raised our kids, he's delivered our, my brother and sister, and it really is somebody who is really involved in what we do. I don't want to say on a daily basis, but an ongoing basis. Is that a fair example?
I think it is because, I think for all of us, we want to be able to check in with our doctor if something's going on and have that person have an idea of who we are and what our overall health issues have been in the past. Also, if that doctor knows you well, when you call in with a problem, they might know, well, that person's spouse actually is at risk from that too, and would be able to be proactive and help to control or prevent a problem from spreading within a family. They might also have some insight into how one person in the family's issue is going to affect the other people. Like, for instance, if I know somebody is a stay-at-home homemaker and they break their leg, and I know there's nobody else in the home to help them, and they have an infant at home, I know I'm going to have to address that particular thing and help make sure that they've got a plan to help their family keep functioning. So having that person in your corner who knows your family well can really help smooth things out when those inevitable bumps come along.
Is it, and Dr. Kim, is it realistic to think, and this is no disrespect to anyone that is a doctor, but is it realistic to think that if they're carrying a patient load of 3,000 to 5,000 people, that what Dr. Burris just described is going to be very, very difficult?
So it definitely is. Having been doing that and knowing many colleagues who do that, it's a burden that you have to start weighing your well-being, your family's well-being against your profession and your oath and your drive to want to take care of your patients. And that shouldn't be a system that anyone has to deal with, whether you're a patient or a doctor. There should be a system where you can take care of your patients as well as yourself and your family and everyone is coming out with a good outcome. And so I do agree with you that in those numbers, it is very difficult to be on top of everything, care for everything, not wonder if you're missing things, but you can't worry necessarily about that because you have to move on.
When it comes to now what the impact, this was even BC, before COVID, that we were having a shortage. Tell us about the shortage across America, and then specifically here in the Coachella Valley. And now we know that, let's just take the low number of 2,000 patients per doctor, what that means to the Coachella Valley, and why we are really seeing, wait times in the hospitals and emergency room, if you feel comfortable enough to go, or in the urgent care. So talk to us about the shortages by the numbers, if you would.
I think Dr. Burris can answer that.
Okay.
One of the difficulties we have is there's been a lot of churn in the primary care world here in the Coachella Valley this last year. When coronavirus hit, we had a lot of doctors sort of slow down or even retire. We had new doctors coming on board who then left. And I'm not just talking about one hospital system, it's the whole valley-wide. So I don't have any definitive numbers to share, but before this all started, we were, around 100 primary care doctors short. And so I don't think we've fixed that problem. The two residency training programs in the Valley, the one based out of Desert Regional and the one based out of Eisenhower, have been trying to address our local shortage by producing new primary care doctors through the residency programs. They have had some graduates stay, but the amount of people that we've had leave has sort of kept pace with the amount that are being produced. So not everyone who goes through a residency program stays in primary care, and not all of them stay local. So those programs will hopefully help to address the problem, but we still have a significant shortage. And if you think, each of those 100 doctors should be taking care of 2,000 people, that's a lot of people who are having difficulty getting into a doctor. And then when they do get a doctor, sometimes within a few months that doctor leaves or retires. I also do work in an urgent care and have seen quite a few people coming through with that story, where they've been sort of established for a couple of years, had a doctor leave, established with a new doctor, and then had that doctor leave. So there's been quite a bit of turnover this year, more than normal. And I think it's caused a lot of scrambling. Patients are sometimes reassigned to a new doctor without having a choice. And so sometimes that's a doctor that they don't feel as comfortable with. So there's a lot of things happening in the Valley right now.
Well, Dr. Burris, I just jumped in. I said, okay, if it's 100 doctors, we're averaging 100 doctors down, and we took the lowest number of about 2,000 people in their system, that's 200,000 people. Now, I think we're in that 425,000 full-time residents here in the Valley. We're talking almost half of the people who live in the Coachella Valley may have trouble getting a consistent primary care doctor. Am I overstating that, or is that pretty accurate?
I think it's pretty accurate. I think there are some populations within our valley that probably have better access than others. People who have straight Medicare often will find that it's a little easier for them to get a doctor to accept them. And then there are other people with other insurances or who have no insurance who may find it almost impossible. So it's somewhat dependent on whether or not you have an insurance that is well regarded in the Valley, and whether there are enough doctors in your area, but we do see a significant portion of our valley who just really is having difficulty getting into a doctor.
When that happens, the thought that goes through my mind, and this goes back to my original question with Dr. Kim when I said, hey, is the system potentially broken? And it was yes and no. And I think, okay, if I can't get in to see my primary care doctor, it means now I have to wait longer. I might consider waiting longer, which may exacerbate my illness or whatever that may be, because I can't get in to see somebody. So I have longer wait times. When I do get in, it's very brief because they've got 10 more waiting rooms of people just like me to get in there, and that's frustrating. So you guys took this initiative to say, okay, enough is enough. This doesn't work. Tell us a little bit about what you're doing now and why we should lean in and really look at the model of Coachella Valley Primary Care.
So we need to put credit where credit is due. There have been a lot more braver and smarter physicians over the last 10 years who got to the frustration level that we got to and said, there's got to be a better way. And so what they decided to do was say, we are no longer going to participate in insurance for what we as primary care doctors do. We are going to step out of the system and create a contract between our patients to provide primary care through a contract, a monthly contract, and use the insurance when it's proper and useful and prudent and wise to do. And so that's been going on over the last 10 years. And so what Dr. Burris and I decided to do was lean into that because it made sense to us. It allows us to have a patient panel size that's manageable. Even so, right now, it's just Dr. Burris and I. We don't have any staff because we just take care of patients. There's no insurance paperwork involved. And so when you call us, you get one of us. When you text us, you get one of us. And this allows us to provide timely and personalized care to our patients. We get to sit down and talk and figure out and have long appointments. We can make appointments over the phone, do video chat, texting, go through pictures, everything that makes sense for that particular point in time for that patient, we can do to save patients time and to get them healthy. And this system allows that because this is between the doctor and the patient. And when we need insurance involved, we absolutely appropriately send them off. The other thing that we enjoy about this, if you don't have insurance, we can call different specialists, we can call around and try to get the best pricing for patients on various things. And a lot of people think, well, what about my medications? What people don't understand is there are a lot of medications that have gone generic, meaning they're no longer owned by the original drug company. Other companies are making them at a fraction of the cost. And there are a lot of resources out there that you can pay for cash that are even cheaper than if you had insurance. That happened to my mom. She has Medicare, and I just was asking her about her meds. And she says, I pay X amount of dollars at X pharmacy. And I looked it up under the resources that are not just ours. Anyone can go on and look at it. And she would pay a lot less if she actually went in as a cash paying patient than if she used Medicare. So there are a lot of things that we can do that will save people money, that will help them keep their costs down.
Well, I want to take a second and talk about, who is the ideal customer to say, hey, this sounds like a good fit. One, I don't have to go to the emergency room. The urgent care is out. But if I do need to use my insurance, you're going to be my primary care doctor that says, hey, it's time to go that route. Who would be the people that probably are best served by this model and you and Dr. Burris?
I think it would be anyone who feels like having good access to a doctor would be helpful for them in their life, either because they have a medical condition that requires quick turnaround in their communication. Say you have diabetes and you want to adjust your insulin levels It would be great if you could text back and forth and get advice during that transition period and not have to leave a message and wait for a call back. Another person would be someone who's can't afford to take a whole half a day off of work every time they need to go to the doctor, or who needs to be able to schedule their appointments at very flexible time schedule. We also will occasionally see patients on weekends, on evenings, especially if a patient has a job where that's the only thing that can happen. Some people's jobs actually
There's
do
one
not.
right now.
Yes. And so patients like that would be ideal. Also, anyone who has a situation where they have a chronic medical condition and no insurance, because trying to manage a chronic medical condition like diabetes or high blood pressure through urgent cares and emergency rooms is not only not very effective, it's very usually ends up with you not managing it very well, but it's also the most expensive way to do it. So it would be much cheaper for that person to manage that type of a problem through us, even if they had no insurance. So those type of people, anyone who just sort of misses having that kind of relationship with their doctor where they're seeing or talking to people over time and getting to know them. Anyone who's tired of never being able to see a doctor and having to always go into urgent care. We have several people for whom we seem to be a good fit.
Let's talk about, you mentioned price. Let's talk about dollars and cents. I don't know off the top of my head, Dr. Kim or Dr. Burris, what it costs every time someone goes into an urgent care or they go into the emergency room because they don't have a primary care physician or they don't have insurance. I know you can probably speak to that, but as an example, how does your program, how do you price it so that it's one of those things that, hey, this sounds great, but when I think of service that you're talking about, it really sounds like concierge service. And I do recall speaking to a gentleman who I knew his son, and he's a concierge doctor. And when you put that on there, I'm thinking, wow, that's probably, $4,000 or $5,000 or more a month. Talk to us about your pricing model, if you will.
Yeah, so we decided to make a pricing model that was affordable. We knew we could price our model pretty high, and in the Valley probably get people to pay that. We could also price it very low, and we could get to people to pay that. But we decided to choose a model where we thought it was a good, fair price that would allow us to take care of someone, be their doctor, and not break the bank. So, for us, we came up with the model of from age 0 to 45, it's $99 a month, and from age 46 and above, it's $145. And there's discounts as you had multiple family members. And we thought this was a good, fair price. We don't mark up anything else we do. We offer a lot of basic labs, the most common labs for free. It's part of the membership because we can get them for such a cheap price. It makes no sense to add that on. We do carry a small amount of meds, and we will start carrying more as our patient size grows. But for an example, I think our Z-Pak or azithromycin it's like $4 that we charge. I think we get it for like, I don't know, $3, and there's $1 for paper and whatnot. So, and so we try not to upcharge anything. If we can get a savings through a relationship, like X-rays are $40 through Eisenhower, that's all we charge because we want this to be a win-win for everyone.
With this idea that you have a monthly fee now, does that mean I can see you once a month, or if I have children, does that mean you can only see Johnny once and Mary once? That's it, or how is that actually set up? What's the structure of that?
The primary care membership covers anything that you need in the primary care realm. So that one monthly membership fee covers as many visits as you need. We understand that for a lot of people, they're going to have a problem that maybe they need to be seen a few times in a row quickly. Other people might not use it for a couple months and then need to come in 3 times the next month. So that one monthly membership fee stays the same. There are no copays. We do not charge differently for televisits or anything like that. But it's what makes sense for that patient at that moment. So if somebody needs to come into the office, we'll let them know and we'll bring them in. If somebody has a real simple problem that they can send us a picture, say they have a bug bite and they want to know if it's infected, we can ask them some questions, have them send us a picture on our secure app that's encrypted for HIPAA compliance, and then we can respond to that problem without them actually having to come into the office. So there are some problems that we can take care of that way, and others we bring people in, but that cost is the same. It's that one monthly fee. For additional services such as radiology services or some type of extensive lab workup beyond the regular yearly labs, we again charge people our cost. So we try to pass the savings along that we find, and they are substantial over what you would be charged in an insurance model. Often our costs are much lower than even people's copays.
It seems to me that the fact that we have access to you, right? I mean, you said something about getting text and in the evening. Not that we want to have people calling you all hours of the night and on the weekends, because I know you have family as well. But we have access to you. We keep our costs down. You have telemedicine, so there's not any concern. If I need to pick up the phone and call, we can do what we're doing now. Have a over the phone, and as you say, it's a secure line. And we don't engage my insurance unless we absolutely have to, because the pricing model, whether it's meds or some kind of labs, are less than even if I would have done that. It sounds like it's too good to be true. What's the downside of your model if I'm one of your patients, if there is one?
Well, I would say, we're not a fit for everyone. If someone really can't afford insurance and something else on top of that, that's some of the reasons why people don't join. But what we tell people is there are ways to mitigate that with a high deductible, low premium plan. There are a lot of also cost sharing plans out there that make it affordable to do a direct primary care and have some kind of catastrophic insurance. Um, there are some people who really like their physicians, who want to stay with their physicians. So we tell them for sure that's something that they can do. And if you want to, if you have insurance through your spouse and you want to utilize that, we know lots of different doctors in the valley and providers that are very good that we point people to. So we know we're not a fit for everyone, but we do think that we're a fit for a lot of people, and it makes sense for a lot of people. I did want to give you an example. We had someone who was admitted to the hospital, and although we didn't admit them and we weren't the admitting physician, they were able to call us every day. We were able to explain what was going on, what's going to happen next. We were able to reach out to the treatment team. We were able to make sure that they transitioned home. And so they were able to move through that and go home and feel much more at ease because they were able to contact someone who knew what was going on, who could explain what was going on, and they felt secure in that someone was in their corner.
Well, I think that's incredibly important. My sister-in-law just went through surgery, and I do know that because of the COVID regulations, she didn't have any visitors, and there were times where no one came in for a long period of time, and her doctor, that he's busy obviously with those 2,000 to 5,000 patients that he's seen or she's seen, and so it's 1 or 2 visits a month. It's nice to know that you can pick up the phone or text and know that you guys are there to support them, because let's face it, that's an emotional time, not only a physically draining, stressful time, but that is a great bonus. Tell us a little bit about how now someone could take action and get involved with you and your programs.
So we have a website. It's CoachellaValleyDPC.com. And if you go to the website, there's actually a lot of information there about our practice, as well as ways to actually interact with us. Our phone number is 760-642-5549. And that's a number that you can call or text, actually. And if you want to set up a free 10-minute visit, we are happy to talk with you and explain it more. Often people have very specific questions about their specific situation, and we understand that for most people, they need to have that additional information before they make a decision. Other people are like, no, I am familiar with it. I know what I want. And then they just want to sign up. And you can actually sign up directly from the website as well. There is a widget that you can click on to do that. Mike, do you have anything to add?
No, they can text the number, and they can email us. If they want to come in and take a look, we're happy to have them come in. If they want to chat on the phone, we'll do that. And so, we just want people to know that there's a different way to access your healthcare in a smarter way that we think, and something that makes sense, I think, for the future. And we enjoy it, our patients enjoy it, and I think it's something that we recommend people to call and come find out what we do.
Well, first of all, I want to thank you guys for coming on and talking about this, and really maybe for some people bringing that awareness that, hey, there are some choices out there. You don't have to stay in that model that anymore. Times are changing, and so is the demands on our health. And having someone in your corner like you guys in direct primary care, it just makes sense. And I can't even imagine. I don't have kids, but if I had kids right now, well, I'll tell you what, I would be so grateful to have somebody could pick up the phone or text or do this, the Zoom call or whatever, however you guys do that, and just know that I could be assured that my kids are taken care of, and I don't have to get in the car and drive them. That always kind of blew my mind. It's like, okay, someone is sick, and now you're asking them to come in, get in their car, drive across town, sit in an office with other people that are not well for sometimes hours. And it just didn't make sense. And to do what you guys do with telemedicine is just like, wow, cutting edge. So I really honor and thank you guys for doing this. On the screen, we have your information. The phone number is 760-642-5549 or CoachellaValleyDPC.com. At this time right now, are you guys taking patients? Because it just seems to me like this is a real no-brainer, and that hey, you should be doing this right now, gang, if you're listening to this. Are you taking patients right now?
We still do have openings. We are not going to take patients indefinitely, and will limit the number of patients we have. But right now we are taking patients, and we are happy to take your phone calls.
All right. Well, you heard her, guys. She's happy to take your phone call right now, and it's a free 10-minute call. Just call the number 760-642-5549, and just let them know, hey, you saw us on one of the Facebook pages or on LinkedIn, and let us know. Let them know that, hey, you saw that and it made sense to you. And whether you're someone with a family, you're an individual, you could be one of those people that, we have a large segment of people here in the Coachella Valley. I'm going to call them, they're the silver seniors, and you'd like to have somebody in your corner. So I really appreciate that. Dr. Kim and Dr. Burris, before I let you go, any last thoughts that we should really consider this and take action?
Well, I would say it's really nice to have it set up before you need it. It's very scary to be in the middle of a health crisis and not have a doctor and be scrambling and trying to find one. It often can take weeks and weeks to get into primary in the regular system. So if you don't have somebody like that already set up, I really highly encourage you to do it now so that when you need it, it will be already set up for you.
Well, here's kind of the rollout, guys. Is, as I said, I kind of started talking to Dr. Burris and Dr. Kim back in probably January, February, and I had no idea. I've been blessed. I've got, I'm strong as an ox, and I haven't had the need to go to a doctor. But they've made me aware of, hey, it's not only going, just like she said, it's not only going when you need it, it's being prepared before you need it. And one thing I love about this is like having them in your corner. And so what I decided, I said, hey, we're already 100 physicians down. Now that the COVID-19, I don't know if there's more than that, and 200,000 people here in the Coachella Valley potentially could be without primary care doctors. Said, let's come back every Monday and let's talk about this. So if you heard this today and you say, hey, I'm happy with my doctor, or I'm already a patient, I'm already in their program, and you're saying you got to listen to this, either suggest somebody watch this program or have them join us again next Monday, and we'll be here at 3:00 next Monday. Also, if you'd like to catch their weekly show, COVID-19 update, that'll be going on. That's on Wednesdays at 3 p.m. right here on their same channel at Coachella Valley Direct Primary Care. Remember, the number's on the screen, 760-642-5549, and their direct website is CoachellaValleyDPC.com. Dr. Burris and Dr. Kim, I just want to thank you for being here and really spending some time with us. I know you guys are busy. Before we got on the phone off the air, you said, hey, it's a crazy time right now, not just because of the COVID, but you guys are real busy. So I really appreciate that, and carving out 30, 40 minutes and helping a lot of the people here in the Coachella Valley.
It's our pleasure, Jeff.
All right, we'll see you tomorrow. We'll see you tomorrow on COVID-19 update.
All right.
Take care, folks. Bye-bye.